we have had what problems this tobacco causes to us, from our health as individuals to the health of the neighbor, to the environment, to the economics, to the whatever. So it is against that background that Ministry of Health said, you know what? Let's join the rest of the world and fight this pandemic. Is it a pandemic? Is it an epidemic? What an epidemic? Because we know that she has said it. Tobacco kills approximately 8 million people daily, worldwide. You can do the maths. Out of those, 600,000 have nothing to do with smoking. They are just there doing their own thing, and then, lo and behold, John is smoking from here, Beatrice is seated here, doing her own things, and then they die from that. Out of those 600,000, 250 are women and children. So let us protect our women, our children, our aunties, our whatever. So the government of Uganda joined together with other WHO countries, and they signed a document called the Framework Convention on Tobacco Control. This was signed in 2007. Then they went ahead and said, yes, we have stamped, we have ratified, we are members, we are parties to this convention. And one of the requirements of that convention is that each country that signed must have a law, like break down what is said in the convention to apply to the community. So what is the purpose? What are the objectives of our law? I want us to listen properly, because this is where we best ourselves to come up with this law. Number one is to control demand and supply. If we reduce on that demand, then the supply will automatically do what? If we studied economics, no demand, therefore supply will not happen. She has shown us pictures of the environment. The objective is to protect the environment from the effects of tobacco. And most importantly, promote health of persons and reduce tobacco-related illnesses. We may not finish all of them. Of course, maybe our vision would be to have no illnesses connected to tobacco, but we shall reduce them. To promote research and surveillance and exchange of this information. So, these gentlemen who went and did research in Meridian and did all these stories, you are actually promoting the law. You have done your research and you're sharing the information that you got. Another thing is to insulate public health officers from health officers and the policies from the tobacco industry. We know that the tobacco industry is promoting cash money. And for us, we are looking at public health. I don't know what they expect when they are pushing out a product that kills people. Eventually, what do they expect? Which people are they going to be selling to? To strengthen coordination, which we are doing here, partnership and collaboration on tobacco control. Remember, I told you, you cannot do tobacco control in isolation. We need guys from the hospitality industry. Why? Because they have a role to play in this law. We have you, we have police, we have districts, we need to have that partnership and to establish a committee that will help us to coordinate all this. Yeah? Because if each one of us is doing their own thing in silos, it would not be helpful. We need to do it in an organized way. And that is why, for example, when I was last year, I don't remember when, we did an operation. We did some kind of enforcement. We arrested people. But please mark my words, I'm not saying I arrested people. I was there. No, it wasn't government. Are you government? You're not government. We had police, we had district people, we had people from the city, we had journalists, we had civil society, those who wanted to join in. It was a whole collective effort. So we need to have all this in place so that we have a proper law. This law came into force 6 months after it was signed, and that was around 2016. So it has been in place for how many years? I didn't stand a month. 8 years. 10 years. 10 years, we must show that there is something happening weird. Yeah? And for 10 years, if someone is saying they are hearing it for the first time, I think we need to up our game. Don't you see? If you are a journalist and you have been in this field for over 3-4 years and you're hearing this law for the first time, we need to up our game. The way this law is structured is that we begin with identifying these people who will coordinate. And these people are also multi-sectoral. We have a chair from Office of the Prime Minister who is in charge of, Prime Minister is the leader of government business, right? So we have the chair from OPM, we have the Director General of Health Services, we have the National Tobacco Control focal person, we have someone from Ministry of Trade, but I think at this rate they are betraying us. Do you agree with me? Ministry of Trade is represented on the committee, but they are the same people who are doing what? Exporting. We have Ministry of Education, representative from Ministry of Education, a person from Ministry of Agriculture. We have someone from Ministry of Gender and Labour, someone from UNPS, because the cigarettes have to be tested. We have someone from the National Environmental Management Authority, and we have a representative from the civil society organizations. All these, they're all doing something on tobacco, but they can't go alone. The purpose is to bring up one basket. Part 3 of the law talks about tobacco smoke-free environments. What do we mean when we say tobacco smoke-free environments? It means we are trying to protect ourselves from this second-hand smoke. So what does the law say? The law says that they prohibit smoking in public places, workplaces, and means of public transport. Can you think of a public place? Do you know of any public places? Bus park? Huh? School. Markets. These are hospital. Can you imagine having someone smoking in the hospital? You're already sick of your own things, and then someone is adding you more problems. Scary starts from. No, we need to do something about it. That whoever contravenes this part, if you are found smoking in these places, is liable to a fine of 10 currency points. Currency point is how much? 20K. So 20 times 10, 200, right? 200,000. Do you think an askari has 200,000? Huh? Do we think he has 200,000 just like that to give out every time he's caught smoking? And by the way, from where we have been, they have told us that the currency point has since changed from 20 to 50. So I think that will be punitive enough. 500,000 is not little money. And continuous, there's a part I have missed. It's 10 currency points or imprisonment for 5 months, or both, depending on the discretion of the magistrate at the time. Are you going to make money? Are we prepared to make money out of these people? As we protect our health, we also make money. And continuous contraventions.
You are frustrated when you arrest somebody or even take a decision. Then if you found somebody or feel somebody smoking, this person is, you remember when we did the operation, who was sitting, we were part of it. Out of the over 30 plus people were arrested. Those who ended up in prison, not even 10. And yet, all these people were caught smoking. So the whole process is frustrated by, when it is police at court, you see, even that night by the time we reached here, big shots, because we are coming here to bring out there. So a lot of people who we think should be cooperative, those who fight and enforce the law are the ones frustrating the process. So to me also, I think there should be deliberate effort to engage law enforcers. The police, those with code. Right now, for me, someone cannot smoke near me, even if you're a minister or whatever.
Exactly, we
because
need to empower.
50 meters that we are supposed to go and smoke 50 meters away from here. Like we are sitting in this house, somebody walking 50 meters down there will find another person.
Exactly.
So ideally, you are not supposed to smoke. There's no free zone actually.
There's nowhere you can smoke, don't smoke. No one has ever died from not smoking, right? Huh? Really, it's baby steps. We must work together. We just sensitize the police. We will try and talk to another group, in groups. One day, sometime, someone will get the point. So it says continuous contravention by a person responsible for premises. Are we talking to the ones who are here? Yes. And it doesn't mean the owner of the bar, it doesn't mean the owner of the restaurant or what. Whoever they find at the moment is responsible for the public place. They can either revoke your license, you, the owner of the public place. If it is a hotel like here, if for example this was a hotel, actually this building is also contravening in some way, then the person whom we find in those premises is responsible because they should have told this person to get out or to stop smoking. So if you have not done that, you can revoke your license or you can go to prison for not less than 6 months. And it says that you're supposed to smoke 50 meters away from a public place. And the public place in this case, we mean 50 meters, we start counting from the fence. We don't count from this building because this whole place is one place. It has to be at the fence, 50 meters away. We count 50, you're in the police. That's a public place. Count another 50, you're in their residences. It's up to you. Find your level. Talks about display of notices. That every premise, every building, for as long as it's a public place, whether a bar, whether a building like this, must have a no smoking sign placed in a place where everyone can see. Don't look for a corner somewhere there. So when they come to arrest you, you say, first you have the sign, it's there in the corner. No, put it here. So that when this person comes in and they are smoking, they will not they will not say, I didn't see it. It should be in a conspicuous place where everyone is able to see. And this sign should look something like this. Yeah? These regulations specify how this sign should look like. It should be in a red circle, not a blue, green, whatever color you feel like. It should be in a red circle with that cigarette, with a smoke, with a cross, with the words, no smoking, and the penalty clearly stated there in the language that you can hear. But it says you can put in English, Swahili. I'm sure most people here understand Swahili. They don't.
No, not most people.
I am disappointed.
No, you can't be disappointed.
Okay, Castor and they understand English. And contravention of this section, I hope I'm speaking to those who are concerned. The person is liable to a fine not exceeding 12 currency points. Yeah? 12 currency points times 20,000. Okay, now let's say times 50,000 because we are going to amend this law. Times 50,000. It's not little money. Or imprisonment for 6 months. Or both. Hey, if the judge has something against you, if the magistrate came to you and you were not responsive, if the police tried to arrest you and you brought manyanga, 6 months or both. And subsequent contravention, you're liable to not exceed 20. Now we multiply. If they arrest you, if they find you this time, and you do the 12 currency points, next time you not do 12. This time you do 24. Or 1 year.
She was speaking about how we can simplify and make the message about tobacco control quite relevant, and understanding who our audience is and translating these messages in the local language. I just want to ask whether you're considering translating the Tobacco Control Act in the local language. I think that would be very important so that the vast of the communities in the region are able to read it. And then secondly, I wanted to ask whether there's something like tobacco and human rights. I mean, why there has to be a conversation around tobacco and human rights. It's very critical. Lastly, would you consider some small budget where you would reward journalists who piece together very good stories, investigative stories around, because I know we have great writers and that could spur more conversation, more great stories, and I'm sure we can do great work. Already there are good stories written about tobacco, so you could find maybe at the end of the year, recognize journalists who have done very good stories. Yeah, about.
Why did you say that in November? Those ideas they say in January.
Well, but this is an opportunity.
You have shown us the dangers that those who smoke pass through. But it will come in the form of a question to the ministry. This has been something that has persisted for decades. What is the ministry's plan in bringing this to total end? Because this is now happening. Should we push this to be handled under circumstances of epidemics? Because the situation of tobacco impact on our health seems to be more dangerous than even COVID. But COVID came in a short time, all funds went there. So I think, to me, I would recommend that the ministry should prioritize this and take it as a serious note that tobacco is silently killing finishing people in Uganda. And then to UNBS, why do we certify products that are harming your taxpayers? If you look at the displays we had here, the first blame I will do is to UNBS. Then you go to the trade industry, because they certify it and get the permission that you can operate. But you are telling us it is harmful. So in all this, to me, I believe farmers have no say when the rule is passed and implemented. So I would think let these bodies not take into consideration for certifying these different companies to carry on these activities. Coming to taxation, URA, these are areas I feel there should be much taxation about. Not these core products that the human beings or the nationals survive on. Now you're putting the tax rate for harmful products little, but the ones which are needed on our daily life are highly taxed.
That one you can relax there. All their ongoing conversations in the Ministry of Finance all the time about taxation. So at least that one, you just know. The people who are not out here in the field are conducting those discussions with the Ministry of Finance.
Okay, thank you. Now, if that is taking place, we recommend that to immediately be implemented as soon as it is done. High measures has to be taken.
And some of these stories to be done, they need financial support. In order to have an in-depth storytelling, but because some of us are incapacitated, the capacity is not enough, we cannot make it. That's why sometimes you will see we'll only do something which is within our area of reach, like within our city, but going to the rural areas like Iterabo becomes difficult. So I would request that if the ministry comes up with some funds in form of grants to journalists to undertake some of these stories will be very good. May not be for individuals, but also you can consider media houses.
But the whole problem is if they do media houses, we really trickle down to journalists.
Of course, if it is media houses, for media houses, you can give it, for example, to a law one with a purpose, specific purpose of doing this kind of story related to tobacco, and it will be upon the editorial team to apportion this kind of budget to the journalists. I am sure if it is to the newsroom, even more than one journalist can benefit from this. So I'm suggesting that the ministry comes up with that kind of initiative so that we can be empowered as journalists to also make better impact.
The dangers of this tobacco, like you explained here, to the cancer, to the diabetes, so that people understand. Because now if we keep on speaking this, recently we've been having a challenge with getting experts, even talking to those people about some things because of bureaucracy, you need to go to the ministry. But if the ministry would also provide for us these experts in the different fields of health, maybe we could be able to interpret them to the local person. Maybe the idea will come. I think I should stop this and I do the other crop.
One of the issues there is the heads of states could maybe perhaps have discussion and influence some of the countries like South Sudan and also Congo, at least to have such kind of also laws that can be also to ban either the production or buying it. That's my suggestion. But otherwise, the issue of porous and also either buying or selling it the other side, we shall not prevent it.
Create a platform for continuous engagement, because I think most of the problems I realize with the ministry activities is when the officials, the experts come like you have come like this, after the discussions you go and there is that detachment. And we get lost even when we are doing the stories. To get, say, the correct information from the other side, it becomes difficult.
So you like a WhatsApp group?
Yes, something like that, so that we keep continuously engaging on this matter. It also keeps reminding us that this is an important bit that we should keep focused on.
Interact with the Ministry of Health about the challenges or the compliance with the Tobacco Control Act. I know our constraint here is time, isn't it? I've seen a lot of interest in this because we have seen the effect of tobacco on both the humans and the environment. However much tax you might get out of it, a lot of it actually is injected, but even beyond, in managing cases of what? Tobacco-related diseases. Is that okay? So it is when you put them on scale, the benefits are far much less than the what? The benefits are far much less than what we spend on managing diseases that are caused by consumption of tobacco. I know you reach more people than us, and there are a number of media houses represented here. I want to thank those at the national level, especially the TV, and I know you have networks. This is, though you are here in Western Norway, in Arua, this information goes across. There are also those who are on the web-based. We read news from other places or what we do. So this is a contribution that you can make to our nation of the world through this interaction. Because we are now connected, actually we are one community through what? Media. There was a lot of interest, conversation about that factor in our district. Yes, I hear you very loud that people have died. This and that is happening. You know, if you want to convince somebody, if we convince somebody, that must be documented, not in numbers, evidence-based. Actually, maybe we can, if we could engage, I know that was material center for something with tobacco. Maybe now this factor is here, if they will take interest and document this. That's when you begin taking far away from the factory as the concentration goes. If that was investigated further, that maybe the chemical matter what in the air and compare it with the what? The acceptable or tolerable level that the science says. Then how much deviation from that one can know policymakers, even international bodies will pick it up, argue for the communities, because those who are living very close. Yeah, that leachate or the effluent from the fact of that chemical that goes with the what? Into the drainage system, the stream, down the stream, that's on the other side. It has two effects. Likely the chemicals have impact. Then that factory complex has a very wide roof area. That area meters, I don't know how much. Even with the slightest downpour, the volume of water going down is in millions of liters or thousands of liters. So certainly the erosion and the what? When it rains heavily, the water going down is not, it erodes the water course. So the environmentalists who are with natural sciences, if they did study that, certainly there's a damage to the water course. So I think if we generated maybe through your writings or your news, maybe it could arouse the interest of people in different disciplines to come and investigate this and display, such that the people who run that factory can be put in order to address certain issues. Maybe the issue of smell or the effluent can be. I remember when news started, that complaint came. And actually, they did what they now call the constructed lagoons. That was when you treat this effluent before it joins the water channel. But that needed to be audited from time to time. Is it doing the purpose? So I think that is the things we need to check and ensure that these people comply. If the lagoon is working and it is checked on a regular basis, that should be the timeline to check on that. So I think I believe out of this discussion and engagements, I know you are going to communicate this out. And deliberately, let us, I already mentioned this in the earlier meeting that we don't have the capacity to do air sampling, soil sample or water sampling. So that if samples from the soil, the water, and the air, picked from different angles, then the chemical, what the findings are compared with what is allowed, then we have a case to what? Present to our parliament or to our people who do policies. And this thing of saying many, you know, sometimes it's very difficult to justify if somebody's cause of death. Is that okay? So, but from the other angle, you could easily argue your point very well. So I thank you for coming. I thank you for the interest we have shown. We have done so many good things with you in the media because we speak to many. For me, I can take time to raise certain matters, but if we are together, we can raise what? Thousands, even millions, because you cover wider area, others have longer what? Others go beyond. So we can, with you in number, we can multiply this. So you get real facts, put it out, then it may bring in other issues. The issue of politics, we can only talk and or influence them when you have data, evidence. Of course, how you can sell it to policymakers is another thing. Once you publish something, you can make it to their interest. We look for alliances with it. Then those influential ones, once it is brought out, they can always what? Support. I remember there was also a tobacco factory causing problems for the community in Kampala. Because they documented that, then they got lawyers. They wanted the factory to leave. Okay? So let's try to gather facts or support, or look for support to get people who can document this, and we can argue so that we can save our population and the environment. Otherwise, thank you, Minister of Health, for prioritizing West Nile, particularly Arua, trying to engage. Arua is a unique city, one among the unique cities. We have so many foreigners. You saw it when the people were taking Sisha. The Ethiopians here, the Eritreans, the Sudanese, the what, then in West Africa, they are here. So it comes with challenges. And you can see this brand of tobacco you pick. I don't know why you pick them, but many of them are in this city. So let us work together and save our population. I smoked a lot, not myself, but when I was in Mvara in those days, boys from Terego, their pillows would be bags of tobacco. Okay? That would be their pillow. They will fill the tobacco leaves for pillow, and they keep plugging, smoking, the remnant, the ground, the bed. Then after that, they will unpack it and roll until it is totally zero. Then they go in the lot. They go back to the village and come with another one. And that's how me I was a smoker, because many of the people said they don't know what smokers. I've not gone back to hostels, but I don't know what the situation is now. But the smoking, people start smoking early because of proximity or availability of tobacco material in the communities. So you pick the facts, you continue. From time to time, you can create programs that continue to educate people. Many will listen, but they will not act, but that doesn't stop us from what? From preaching the news, the gospel of what? Against tobacco. We are suffering, grappling with so many diseases that are preventable. One of them is by doing this. So the complications of these are more managed, of tobacco consumption are more complex and more expensive to manage than these other communicable diseases. So whatever we do will contribute in saving government revenue when people don't suffer from the effects of this.